focus is primarily going to be within the healthcare space and AI ML area. So as soon as you think of what, the healthcare, the first thing that comes to people's mind is the patient health information. We need to protect them, the confidentiality, and everything that goes with the PHI, patient health information. And then on the other end of the pendulum is going to be the artificial and machine learning based products. Some of them involve unstructured learning models to look at data, go behind the data, look at the metadata of the data and stuff like that, and come up with prescriptive and recommended solutions. So can you help me understand, on the one end, we want to have data protected, secured, and the other end, we want to have data a little bit more open and volatile so that we are able to look into these things. So can you help how the AI-based solutions are emerging within this space?
Sure. So yeah, within the space, AI is used in healthcare in multiple different ways. I mean, it's used to help streamline processes, to help look at bulk data, to analyze trends, patterns, types of diagnostics. It has great potential in the field because it does help with, besides data analysis, general genetic structure, disease treatment, drug creations, and it's a big time-saving process for a lot of big hospitals and big healthcare providers. Additionally, can be integrated into medical record systems that are used, and that really, especially a lot of those that are pretty clunky and are not always the most optimized sometimes, and for good reason because of how complex they might have to obey HIPAA laws. It's a huge potential. It does cause some issues and bring up some problems because you are dealing with health data, you're dealing with PHI, and when you do that, you're supposed to, within the realm of HIPAA, keep it contained. You're supposed to keep it in systems that follow certain security standards, that follow certain encryption standards, that the flow of data doesn't go beyond where it should. You're not properly sharing the data. You're not giving it to entities or putting it in places that any other entity can easily extract out of, that it's not easily exposing. So PHI under HIPAA is supposed to be contained, but when you give it to these machine learning algorithms, these AI entities and structures, where they're stored, what areas are processing this data, it makes it very difficult to skirt that law. And of course, people constantly talk about HIPAA, but HIPAA is, to be, perfectly direct, sort of antiquated for this time period. I mean, it's proper in terms of the security measures you're supposed to take, but it has not caught up to this new level, this new landscape. We have a lot more alternative healthcare providers, health apps, health tracking applications, a lot of them using AI to process data for internal research. This is a new realm of healthcare or health data processing, and not all of those applications, not all of those programs fall under what HIPAA currently regulates. So it's an uncharted field, and so when you're trying to maintain data in an ethical way, and process healthcare data, you want to make sure that that you make that balance. And right now, a lot of entities are struggling to understand how to make that balance correct. And it's all about how the fact that data, along with any other personal data, is so valuable, right? The people have, and I'm pretty sure you yourself have said that, data is gold, right? This is not an unusual concept that most people recognize, that personal data is very, very valuable for advertisers, for any entity that's attempting to reach you or to sell you something or to process information. Information is very important, very critical. So from your perspective, I know that you've talked about things like adversarial attacks against telehealth, things like that. Can you expand on that? Because that's something that is in more of your purview.
Definitely. It's very interesting that you mentioned HIPAA has not caught up, and that's very true. Regulations are always on the catch-up game. That being said, you talked about the adversarial attacks over here. So first of all, anytime when we talk about AI is using the data that we are using it to train to come up with prescriptive and predictive approaches. So the efficiency of the data, the effectiveness of the data is dependent upon how well the data that we are using it to train it consistently for. So from that aspect, when the health data that we are providing, or the data that we are providing it to actually train, is going to be compromised, then any vulnerability that we are having in that particular data, or any kind of preconceived knowledge that you have that is opened up, is going to be opening up for adversarial attack. And it's not any much different from any of the security vulnerabilities that we try to have. Simple example, if you know your password, you can hack your password. If you have only a 5-digit password, which is very easy, then the combinations are very simple, so you are able to hack it. Similar concepts over here. But when it comes to adversarial attacks, within the healthcare space of the AI, you're not just talking about data being lost, but the impact of the data on the solution that's going to be given to the person. So maybe an improper diagnosis, inaccurate dosage given. As a result of that, there could be a loss of life, or a loss of a part of the body functionality that could come into play. So it has a long-term effects that cannot be necessarily addressed by issuing a patch to a security software. Right. So that's adversarial attack. And if we can categorize the adversarial attack, in my simple brain, two different types. One is going to be white box testing that we normally call, which is where you have some kind of a pre-knowledge about what is the data, how is the model working, what are the configurable parameters within which you can actually tweak the model or train the model and stuff like that. So somebody knows some information about that. And now that is used to actually compromise the model. So you inject a small amount of inconsistencies and see how the model reacts. And if the model is, reacting too much on one end, we come back and say, all right, now it's potentially possible to actually alter the sequence in which it operates and, go in a completely different way. So, but that's an intentional way of, adversarial attacks.
Right. Right.
The second approach is more of a black box, testing, where we don't know any information about this, but then we come up with lots of input parameters and, load it with like this information, that information, this and that, and stuff like that, and see how the model reacts. Maybe one or a combination of some input parameters actually let the model go in a different order, different way. And now you have some information to say, all right, let me go ahead and, exploit that vulnerability or the specification that I have actually, understood a little bit more about. Right. Again, this is not too much different, because in the concepts of security, we talk about social engineering, right? Where we know some information about how the security principles work, and we actually give the card to somebody else so that somebody else walks in. And we have seen this in movies, right? Somebody has access to a card or something, that people let you in, and now you have access to the entire secure system that you are supposed to not have access to.
Right.
And the same thing, yeah, go ahead.
And also, it's also hard to gauge how you detect that, especially in an AI model, because it can act in ways you don't expect. And this is a new charting realm. So when you're basing your identity off of, oh, this should act this way, but if it's in a completely new technology, that's hard to gauge.
Right, it's hard to gauge, because we are actually, in the AI, again, to make it very simply, it's artificial intelligence, right? So we are trying to have some computer software have some intelligence constantly getting built based upon the data that we are actually using it for training. And the more injection of incorrect data that we are trying to give, it cannot form the right information. So it's basically saying like, okay, this is what is the right information. And this goes into, again, I won't go into the details, begin the confusion metrics, what is true positive, true negative, false positive, false negative, and all those things, because that will be a chapter by itself.
That's a whole other section, yes.
Yeah, whole other section by itself. But the idea here is using these techniques, black box or white box. People do come up with 4 different ways, and I'm known in my world as a man of acronyms, so I come up with a lot of acronyms to keep myself straight. And I use the acronym called PETS to to see how these white box and black box can emerge in the artificial intelligence world. So one is, the P stands for the poison. Right. So you are injecting an unnecessary aberration in the data and see how you are working on it. And if your body reacts to this in a different way, now you know that, okay, you found a touching parameter, right? That's one way. The other one is going to be evasion. Evasion is, again, I'm sure in movies like Mission Impossible, I'm sure you would have seen where you'll have a lot of data patterns that we cannot touch this. There is a pressure sensor there is a laser there, and stuff like that.
Mhm.
And the Ethan Hunt actually maneuvers himself around, or in Indiana Jones, you have the same thought process where Indiana Jones does something to evade the system, right? So the same
Right.
concepts over here. So you know what the anomalies are, or you are able to predict what the anomalies are, and now you are wavering around that. So that's the second approach
Yeah.
called evasion. And the third one is called more about transferability. And here you may not know anything about this particular system that you are trying to subject to incorrect data patterns, but you may have a different pattern. So you may actually know some information. This is like, lessons learned applied in the wrong way. So you learned something about some other system in the, and now you are taking that information and applying it over here. That didn't work there, so I'm going to try it over here and
Right.
see if that will
Right.
work. And so now you are exercising those things. And finally, the surrogate model, which is going to be, you can access to this particular target model that you can, because of security vulnerabilities that you cannot hack and stuff like that. But then you simulate another model almost as close to the actual target model and see how you are able to make that model weak and not necessarily survive. And now you have practiced as much as you can, and now you are taking all those learnings over here and apply that. These are some of the best ways people try to come up with in terms of the adversarial attacks. And again, I had to be very honest, the simple rules of prevention, like the training the model consistently with new data, auditing, making sure that there are
Yes.
proper anomaly detection is in place, and check them in place repeatedly. Just because
Yeah.
it doesn't mean that you are following it.
Right.
And those are simple techniques in which you can avoid these patterns for adversarial attack.
Mhm.
Well, since we talked about this adversarial attack, I do want to ask you this question, because a lot of the times the procedural languages like Pascal, C++, and all those things, we start with sequencing, branching, and looping. This is the approach, and you use if logic or case logic to actually branch and stuff like that. But with respect to AI, it's also building its knowledge base so that it's not going to be a straightforward linear path. It's going to be non-linear passes. So at the end of the day, how is the actual program going to eliminate any kind of the bias that the programmer may have in developing the program? Any thoughts on this one?
Yeah, sure. Yeah. Yeah. That's always been the case of even before AI, even before we let programs off into the world to try and learn for itself. Analytical programs have always suffered from the fact that someone programmed them, because everyone has a bias. Everyone has, and it's not necessarily inherent in how you think about maybe certain perceptions of society or certain things. It's like how you think, how your internal brain logically process information, how you recognize analytical patterns. And when programmers create these AI programs, they are building these inherent logical structures and analytical approaches that are still based on their perception. So these programs are, as much as they're going to learn for themselves, they're starting from a base that was provided to them. The other thing is that when you're talking about, say, analysis of medical information or medical data, it's very complex in terms of attempting to analyze or attempting to provide diagnosis or solutions or answers to very complex problems. So when you have, say, an AI model look at a huge swath of medical information or PHI in some context, it might come up with a solution, but that solution might not consider all of the factors that a true, like a human data analyst or a medical professional might recognize. So it can look at maybe a bunch of different symptoms, but not take into account every other factor of that person, where they live, where they grew up, what they were exposed to, what demographic they're part of, what culture are they part of, right? So it requires a multidisciplinary approach, and that's not always easy for a program to take into account. And if a program does take it into account, is that data even available? Because again, we're talking about PHI being a very sensitive element, and you don't want that to be easily accessible to anything. So one of the more what most companies now do, or what a lot of these analytical companies do to adhere to HIPAA, if they are adhering to HIPAA and if they're under the HIPAA law umbrella,
Mhm.
they de-identify the information. So they take out the identifier, they take out the name, the address, location, all these other things, so that this is just pure raw data that it can then clump in with a bunch of other medical data and try and analyze from there. But that again, you're stripping out key elements of information that might help with the actual diagnosis. So it's hard to balance that. And with the most intelligent, most advanced AI, the more data you give it, the more chance it can re-identify you. It's like it can build this picture and then figure out, oh, you're talking about this person, you're talking about this group of people in this section of the country, or wherever you are. So it's difficult because of inherent bias, but also because of the nature of medical information specifically in this context, requires such a nuance of different factors that you have to consider. The other issue is that this information is being used and being extracted in so many different ways that when you're talking again about organizations that are under HIPAA law, when you sign certain contracts, they might be somewhere in that contract saying or authorizing, you are authorizing by signing that contract the utilization of your data in some type of analysis or some type of study. This is very common, especially in third-party apps that are healthcare apps, or however they want to quantify themselves. So it's a question of consent, right? It's a question of how much data do you want to give to someone? How much data do you want that data to be used externally? And a lot of the times it's very hard to answer that question because of how complex the data analysis is. So from your perspective, how is informed consent done? Because that's something that has come up also in this sphere. And I think it's something you've talked to before.
Yeah, definitely. It's very interesting that you connected that particular topic with the informed consent. Most often, I always say data is like, the pure gold. At the same time, in the healthcare space, I also say patient is the king, right? The patient should be able to make a king or queen. Okay, so the patient should be able to make appropriate decision and not necessarily the program. And oftentimes, if you strip away the artificial intelligence model over here, oftentimes there is going to be a discussion between the physician or the healthcare provider and the patient to say what is working, what is not working, how is it supposed to be done, and many other things are going to be happen. And there's going to be this concept of verbal communication and non-verbal communication. Both are going to be picked up by the physician and say, all right, I don't think I can prescribe this medication because you seem to have bodily reactions that tell me that you don't like this.
Yeah.
Something like that. So even though the patient doesn't say anything, the nonverbal communication, the facial gestures, oh my God, I have to, relive that moment when I had this 13 years back, and things like that will come into play. So the informed consent is actually taking place in that context where the physician is looking for some feedback from the patient to be able to make the appropriate decision. But the patient is not going to be always, informed, knowledgeable about all the medical procedures and stuff like that. And so there needs to be some simple level, discussion that needs to happen as well. Now, when you add this, the AI model into the mix over here, into this equation here, not only the patient, but also the physician is dependent upon the AI model that is doing some work. So an example is, I had to go through some kind of a medical procedure. I won't give you in the name of patient health safety. So I won't give the name of the doctor or why I was getting treated or where I was getting treated and stuff like that. But there was a time period when there was this particular group of people before I was taken into the surgical room. They were asking a bunch of questions, but they were limiting all the questions they were asking based upon a computer that was actually taking some information from me and using different vital signs and stuff like that. Mm-hmm. And I
Yeah.
had given at that particular point that I was taking one specific medication, which was relating to blood sugar. And
Hmm.
before I was actually moved into the actual room, no one took my blood sugar at that particular point. So I asked, like, okay, are you all done? Am I ready to be wheeled into the surgical room? And they said, yes. Do you have any questions? So like, okay, who checked my blood sugar because I said this medicine I am taking, and who checked my blood sugar because I've been fasting from the day before for this procedure. And I don't think anyone checked for this. Everyone seemed to be dependent upon this particular machine that said this, and
Hmm.
nobody
Yeah.
asked me this question. And they said,
Yeah.
like, oh my God, I'm sorry, I'm glad you remembered. But and then they follow to the whole procedure. But that's where I'm asking, like,
Yeah.
informed consent goes both to the patient as well as to the physician. So both of them have to be informed at this space. So provide enough information to the patient in terms of what is the AI model doing, what are its boundary conditions, what it can do, what it cannot do, and and what point will the physician take over the model, because the physician's knowledge of the medical procedure is much more than the AI model's procedural knowledge. And so I'm going to take it over. So that kind of
Yeah.
informed consent, like what is the time frame I will look into, what things I will allow this model to make recommendations on, what I will not do. And the discussion has to
Yeah.
happen both to the patient as well as to the physician. So there needs to be a three-part circle there.
And it's also it goes even beyond. I mean, again, this goes back to the fact that what is health data, right? Because health data, it's not just you in a talking to your doctor. It's not just you having a direct conversation with a nurse. It's health data now. Again, we're talking about data is gold. So many things try and extract valuable data in everything that you do. So you have so many different applications now. I'm a huge amount of people here probably have maybe some type of maybe a watch or using some type of application for some type of health tracking, whether it's for sleeping, whether it's for heart rate, whether it's monitoring your blood sugar, whether it's looking through all this and for mental health. There's a lot of different applications now that you can have on your phone, you can have on your watch, and so much of that is again in this gray zone that HIPAA doesn't really cover yet. So you have so many different applications now that are assuming consent because you downloaded it or you created an account, and so this applies to so many. It goes back to there were a lot of different questions about what counts as health data when HIPAA was going to be reformed, or maybe about 5 years ago, but they didn't go through a lot of different internal political tension and issues at the time. But I would like to point there's a series by the Mozilla Foundation called Privacy Not Included, and it started around 2017, and it was a program where they looked at all these different hardware. It started with hardware, and then it eventually moved into software, and it was looking at especially like exercise machines or health tracking apps like Apple Health, Samsung Health, whatever they are, and how much data they extract, where do they store it, who do they share it with, right? And again, it's the assumption that you're giving this consent because you downloaded the app and you pressed start, you pressed record, and that's that. And so the Mozilla Foundation has this review where they look at all these different things, looking at how the applications were designed, how they process the data, who do they share it with, what contracts are you signing, what are the terms and conditions, the 500 page long thing that no one reads. That's all there, and it could just be hidden very deeply with the reputability. So that's one example of that, where entities and nonprofit organizations now that are dedicated to privacy are looking at this very intently, and we'll see if the regulations catch up, but it's the question of what does consent count as when health data could be anything. Health data could be location data, where you were last taking a clinic. There was, given a few changes in American laws recently, there were a few entities that stopped sharing certain health data or stopped recording certain health data. Google stopped sharing location data if you were by certain clinics. Samsung Health stopped recording specific women's health metrics or stopped storing on the cloud rather. So it was the idea of consent and the idea of what counts as health data has expanded and has expanded a lot.
That's very true, because in the context of security, we often talk about PII, like personally identifiable information, which is less context sensitive, or the PHI is a lot more inclusive than the PII. So that's very good. And you also mentioned something about the contract, and thanks for bringing that Mozilla Foundation privacy not included. That's very good, Ian. And one of the things that you talked about is that contract, like the hidden contract that you were talking about.
Mm-hmm.
And even in the context of the software that we are using to actually build AI models, like where you are accessing the data in a different location and processing it and stuff like that, we get involved in this API, the API itself that we are trying to conceive from other sources and stuff like that.
Yeah.
I remember, API itself is considered a contract, and not the SOA or other things that we have, the Visible or whatever web services that we are using. People don't consider them as a contract, but it is a contract. A software to software contract is the API at this point, and so
right.
we have to start looking at those elements also to figure out what is accepted, what is not accepted, is it doing what it is supposed to be doing, what are some of the security related focus that we need to actually look into, and stuff like that. So some of the non-functional requirements that we have to test based upon how these APIs are wired has to be actually factored into the equation as well. Excuse me. Now, on that note, I do have a big open-ended question for you, Ian, because we talked about API, we talked about privacy, we talked about security, we talked about a lot of different informed consent and stuff like that. Now, technology is here to stay, and these AI ML solutions are only going to expand more and more. It's not going to go away. Now, as security, privacy, and these elements continue to take more and more increased focus, at the same time, technology coming up with more and more elevated solutions to address these things. In general, what are some of your recommendations for security standards, privacy standards that we should take into consideration as any healthcare organization or clinic or physician tries to come up with their own AI ML solutions?
Sure. Yeah. I mean, it's a little bit of uncharted territory, but keeping in line with current security standards is the number one thing I'd recommend, right? So you getting audited and make sure that you're compliant with HIPAA, with SOC 2, with GDPR, with CCPA, making sure that the processing of data that you have to do, the storing and processing of data is aligned with best practice standards, and preferably even beyond, because sometimes best practice or regulations aren't up to the latest potential solution. So making sure that you're adhering to those standards, but within that context, making sure that your data is encrypted at rest, it's encrypted in transit, that access control is properly maintained, everyone has good secure passwords, that your EMR system is locked down, again, within access control, that you have control of all the devices that doctors or physicians or anyone in the medical system signs into. So you have some type of device management system, making sure that, if those are stolen, does that have sensitive data on it? Are those encrypted? And making sure that any service that you use as a provider, as a hospital, as an insurance company, whatever that happens to be, any service that processes this type of data, that processes medical data, that uses it for research, that uses it for the myriad of different things you can use this for. Again, data is gold. That those vendors that you're vetting those vendors. You're not signing these people on just because, their website looks shiny, or that we had a good conversation. You have to make sure that they are also adhering to HIPAA, that they're also signed off, that the regulators say this person is good, that they have a reputation, that is of a company that is taking it seriously, that knows how to store data and how to process data properly. because you want to be aware of any potential attacks against those systems, whether it's ransomware, whether it's viruses that try and pull things out, whether it's man-in-the-middle attacks that attempt to pretend to be your organization. So a myriad of different things. It's a long-winded answer of saying make sure that you follow security standards, the industry security standards, especially because as AI comes up in other spheres of influence, AI created malware is a potential threat on the horizon. And that means that there's going to be more and more entities or programs that are going to try and get into your system. And so you really need to make sure that you be proactive now, and that the processing of all that data is safe and properly maintained. I think the other thing in terms of product development is that there's so many, and with this it includes hospitals and medical programming divisions or groups, in that when you build these systems, that everyone is distinctly, acutely aware of what these things are doing, that everyone has training in AI, that everyone has proper knowledge of how they should create these systems to handle the data properly, to store data properly, to strip identifying information out when applicable. From the product development standpoint, you might be able to speak to this a little bit more, but is there any specific training, AI-based or AI-adjacent relevant training that you might be aware of?
Yeah, definitely. A couple of things that come to my mind in the realm of product development. Oftentimes we come together as a team members and say, we're going to start developing the solution, the product, and it doesn't matter whether you are in a plan-driven approaches, change-driven or flow-driven or whatever approach to product development you are taking. The team members come together and say, okay, my charter is this, my strategical outcome that the company has identified is for this, or the PO has identified this, project manager identified this, whatever it is, they continue to work on right away. But one thing that I always tell is think about the user, the end user, not just the customer, but the customer's customer, the end users who is going to actually use that. And from that angle, start thinking for them. So just because technology can create something, it doesn't mean that technology should be used to create something. So be an advocate. Use technology, don't get used to technology. So you have to start thinking in terms of, from an ethical standpoint, is this the right thing to do? Yes, I'm able to solve this particular problem. And I'll give you an example. There was once, one of the group that approached me, basically said, can we use some kind of AI ML solution to look at all the different lab forms, like, the blood reports, different types of blood reports, different types of, blood panel, liver panel, and, many other things that, the customers are, patients are taking. Can we actually scan them and use some kind of AI ML model to take that information from PDF, put them into some kind of text-based stuff, and use predictive modeling to say, if you are X and if you are Y, chances are you are going to have, heart disease by, such and such a time frame. Great idea. But did that person give the informed consent to actually have all my data stored and converted into this particular thing? That's not there. So that's a question that the team member should ask. Can technology, yes, you can find some PDF parser or something like that to actually put this into some kind of formula, some kind of, yes, everything can be done, but should that be done?
Yeah.
That ethical thinking needs to be in place. In fact, there are 5 different important pillars of that ethical digital ethics. We are getting into that mode right now, where we are creating more and more solutions, and just because we are creating a solution, we are enabling somebody to take a behavioral challenge, behavioral change, and that could be potentially good or bad, and we don't know that. You have, and I have this iWatch, and every time I'm sitting and doing something or I'm walking something, it automatically detects and say, hey, you are walking, can I start your workout now? I don't want you to. Don't interfere with me. Don't interfere with my way of living my life. don't control my life,
Right. Right.
So beneficence is very important. That's one of the first principles of digital ethics, which is beneficence, which is like, no, I am trying to create a solution that will support some mundane tasks or some information for the individuals or a larger society at large. Okay, so that's one thing, that beneficence. We all have it in heart, but we need to come back and start asking, should this product be done? Should we develop this now? Should we develop it this the way? The same logic applies. ChatGPT. ChatGPT was a pilot model.
Mhm.
But as soon as we create this, now we are becoming so used to ChatGPT that if ChatGPT is down, I cannot write my email because I'm used to writing my email by some provider that will tell me how to format my emails. No, Grammarly, I can write my grammar-free English stuff. These are not acceptable, right? The next one is going to be the non-malfeasance. That is about thinking from an abuser perspective. In my product orientation, I always think like, don't think like the standard happy path user, but think like the non-happy path user, the abuser persona, somebody who will abuse your product vulnerabilities to actually do something incorrect or inappropriate.
Right.
Think from that abuser perspective and then create this. If we had detected that, then the cell phone that have the iPhones and smartphones that have this camera functionalities, that should be able to detect like, okay, this is a dark room, this is a private room, we should not have the camera turned on. Otherwise, we wouldn't be actually having all these inappropriate images being photographed and stuff like that because of the camera functionality that we currently have on phones. So that's called non-malfeasance. So thinking from an abuser perspective as to how the product that we are developing could be more harmful than helpful.
Right. Right.
And the third thing is about justice. This is about like, how am I eliminating about bias? And we talked about this, the algorithmic bias or the programmer creator bias and stuff like that, that you explained. I won't, go into the details because you articulated that very well. So that particular aspect comes into play. So how are we eliminating bias in our programs, in the way we train the data set, in the way we identify the data set and the parameters that we use and stuff like that. And last but not the fourth element, I would think, is more of a autonomy, giving the individual, the end user, the right to do the choice, make the selection, rather than being forced to say, okay, now that I have categorized you like this is what you are. Many times, when I go through some of this, transport security, stuff and stuff like that, they will basically come back and say, you are not who you say you are. My name is quite long, 16 character or 19 characters long, and it gets chopped into identification mechanisms. And they look at my passport, they look at this one and say, this is not who you are, because the system actually makes a decision that I have to go through this channel versus that channel.
Right.
So that is an autonomy, giving the end user the right to choose the right approach. So these are all, foundational principles in terms of the beneficence, non-malfeasance, justice, and autonomy. These are very critical. And when you actually make it a lot more publicly known as to how we are making decision, that's called transparency. In fact, that transparency is what starts with the agile approaches and, say empirical pillars is transparency. It's not just giving everything to everybody. It's making sure that everybody can put, ideas into this. That's the risk development model, risk-based testing, risk-driven development. All these things come into play as part of your digital ethics. So more awareness should be given to the developers, to the testers, to the designers, to the project managers, program managers, scrum master, all these members about what are digital ethics and how do we bring those digital ethics into your day in and day out life as part of your product development. That is extremely critical.
Yeah, that makes sense.
Yeah. Any other thought that you have on top of this?
I think that was very well said. I think, I mean, it's the core element of thinking more about not whether you can do it, but whether you should do it, right?
Right.
And the potential impacts of that. The maleficence, right, is the non-maleficent. That was the second one you mentioned. Is interesting because it's something that is universal to all software development. And it's just, in general, you should assume that your program could be used for some malicious purpose, or your program could be broken and tried to jump off. So you want to build it in such a way that it's not only secure and you can't extract it, but you can't extract the functionality and use it in a way that you're not supposed to, also known as hacking, but that the core functionality itself is not problematic.
Right.
Yeah.
Correct. I think, fundamentally it is all coming down to, we have this statement called buyer beware. Similarly, we should all become more aware and more trained because many decisions are taken away from us because of this AI-based thinking, AI-based modeling and stuff like that. But at the same time, many more decisions that we never even thought are coming back to us.
Right. So it's an uncharted frontier.
Right. It's an uncharted frontier, and there is more to come. There is more that is really required of each and every one of us. Everyone can make a difference in this particular space.
Yeah.
And so I am going to see if there is any questions that people are having. At this point, I only have comments that basically say, good, like it, I love it, trying to soak all the info. Thanks so much again. So I don't think I have any questions, but I'm going to maybe wait for 10-20 seconds. If there are any questions, please use the chat forum to ask a Q&A to ask the question. Or at this point, I can monitor the chat also. If you want to put the questions on the chat, that would be good too. Thanks, Ian, for great discussion on this topic.
Of course. Yeah, it'll be interesting to see how we move forward, how the future develops. Again, I mean, a lot of this is just, we don't have the guidelines because it was never something that we considered before. Or rather, it was, but the regulations and had never built or prepared for it. So yeah.
Right. And like you said, regulations are always doing a catch-up.
Right. Yes.
You do something and then we come back and say, oh, we have to update this. So it looks like there are no questions for us, Ian, but I don't want to hold everybody at this point. So we are almost 10 minutes into the program. So thanks, Ian, for a great discussion. Again, as Ian was also mentioning, let me wrap up this webinar. Future is not yet written, but the future belongs to all of us. So each and every one of us can make a big difference in what the future that we want to see to unfold. So with that, thanks again, Ian, for your support, and appreciate all the feedback here, and we look forward to the next webinar coming up soon.
Yeah, absolutely. Thanks for having me. Great discussion.
Thank you. Have a good one. Bye-bye.
See ya.